just following up on what Jonas was saying, is that like entropy per se, like putting your brain into a particular kind of state, is not going to explain everything you get out of the practice, right? So it's like, it's almost like if you imagine entropy as like liquefying the patterns of the brain or making it much more malleable, and but then you need a container that's going to determine like what shape is that malleability going to end up in, because it's not that like just being liquid is good, right? It's that sometimes you're in a shape that you want to be able to like flexibly orient yourself out of. But there's always going to be a question of balance. And there's actually, I think it's really important to point out that there's a lot of pathological or like, difficult states that humans get into that are on the other side of the spectrum, where actually they have too much entropy. There's not enough boundaries. There's not enough of a sense of like solidity of who they are and what their life means to them. And so it's really more about, finding these balances. And I think the social, the social container that you're in is going to play a huge role in actually what you get out of the practice. And so what we're really interested in is showing that, how does entropy relate to that social container? So do some social containers actually promote more entropy? And then does that increased entropy also make you more susceptible to the influence of that social container?